The second mistake that a lot of people make is they think that a startup is a have-a-go hero place where we've got a bunch of people who've got an idea, so we'll just have a go. It's actually way more structured than people think of what you need to do. And there are certain steps that you just have to do to be able to do it. And one of them is raising money, right? You've got to raise money. No money, no idea, no business. And I'm going to come to this word 1,000 times. Startups are startup medtech businesses. So an idea is not a business. And once you get that into your head, that an idea is not a business, it suddenly becomes clear and clicks. An idea can be a business if it's the right idea with the right market and then implemented in the right way. It can become a business.
Welcome to this episode of the MedTech 101 podcast. And today is quite a unique podcast in the sense that usually we tend to talk about technology, companies that come here, CEOs have their devices that they're talking about. But today we're taking a slightly different turn to things. We're focusing on how to be rather one of those CEOs that you see on this podcast that tend to come here and discuss their devices that they've worked on. But today it's mostly focused on how to start a startup in MedTech, what's required, what makes it such a difficult minefield to navigate for a lot of companies. And I'm joined with Steve Bell, like he's quite popular. I'm even honored to have him here on the podcast today. He was a Chief Commercial Officer for CMR, which is one of the sort of like the big startups that came out of the UK in recent years, and anyone who has passed through Cambridge, whether by train or to visit friends, has heard of CMR Surgical. And after that, but his career progression is also quite impressive. I think I've mentioned it quite a lot. I think he did psychology, and then he worked in sales, and he had a tremendous career growth. And we'll be hoping to pick his brain as well for young people listening today, for those people perhaps who might not want to start a company, but also might want a few tips on how to climb the ladder as well. So Steve is quite versatile. So yeah, without much delay, thank you very much, Steve, for coming on the podcast.
No, thank you, Rodney, for having me. It's always a great pleasure. And I do watch your podcast and I listen to your podcast. So yeah, good job on it. Great job.
Thank you very much. Just trying. I always laugh about this to my friends because I never actually did media. I did biomedical engineering. So I'm basically an engineer working in media, even as a way to try to bring that technical flair to discussions when it comes to discussing medical devices. And yeah, just to kickstart the conversation. And I'm trying to pick my mind to think, where could I start? Maybe we could properly start at what has led you to where you are today with how to start a medtech startup.
Yeah, that's a good question. So my career spans over 30, it's actually just nearly 35 years. It's my 35th year. So that's why I sometimes say 35 years. I've done sort of everything in medtech, and I only know medtech. I only know medical device. I've done a little bit in diagnostic as well, but I don't know anything about bio or pharma, right? I'm useless at those things. I know medtech. And that's important for later, because when I talk about the fact that I teach people how to do medtech startups, I'm not teaching people how to do biotech startups or pharma startups. And I think that people who come from the bio world or the pharma world will fail miserably in medtech, just as I would fail miserably if I went to bio or pharma, because they're so different. So that's the first thing that I would sort of shout out there. My journey in medtech has been really, I was at one of the best companies on the planet, which is Johnson & Johnson. And it was through one of the heyday times, which is the 90s, where we did open to laparoscopic surgery. And that was a fascinating time. I was a sales rep there. I was a regional manager. I was a marketing manager. I did special projects. And then what happened in that is I actually got put onto a lot of new companies and new ideas within ethic and endosurgery. And that was my first sort of, I would say, foray into looking at starting up businesses. And I don't mean a real startup, but starting up businesses within a company. So that was Cardiovations, was the first one that I did, which was a cardiovascular startup within ethic and endosurgery. And that's the thing where I got the buzz for it, where I sort of really got into the side of, oh, I like building from scratch. I like building from zero. I'd done similar in ethnic and endosurgery, but it was part of a bigger organization within J&J. Then I did cardiovations for a while, got it to a certain size. Then I did the same at Gynaecare, building some of their uterine surgery divisions within Gynaecare, and some of their work with a really great mentor of mine, Laura Angelini. But again, I was doing kind of startups within the J&J franchise, but something
Nice.
in my heart told me it's not a real startup, right? It's you've got the mothership to sort of fall back onto. But it gave me a taste of how do you go find an idea, ask for funding for an idea, even within the organization, and then take that idea all the way to market and then commercialize it. And we were very successful. You know, in Gynaecare, we were extremely successful, and we commercialized multi-million-dollar franchises out of ideas that we had. So that was my first part of my career. So I don't know if you've got any questions around the first part before I transition to what I would call real startup.
Yes, yeah, just a quick question really with that, because I know you started in sales, and for my sort of like analysis I did for your career in your early years, I saw you were basically kind of getting promoted roughly every 2 years. Was that because you had good guidance also in that framework? Just as a quick side note for people wondering, and because I'm sure some people will go and check your LinkedIn and they'll see every 2 years like you got a promotion. That's how you climbed quite fast. Was that because of of course I know there's merit, because obviously that's why I have you here on the podcast, so there's a lot, but also what other factors should like young people listening right now like think of, just slightly deviating from that in terms of doing the quick progression just within J&J when you started there? Because I
Yeah.
was also at J&J, which was also quite interesting. Yeah.
Yeah, so I think there's several factors to it, and yeah, merit is part of it, and I do like to think that I was working hard and doing lots of good things. So merit obviously comes into it, and you have to be good at what you do. But it is also a little bit of that is being in the right area at the right time. So I just happen to always be in growth areas. And when you're having growth areas, there's always new management needed as you expand. There's always new senior positions needed as you expand. So one of my pieces of advice to people is go and try and find growth areas. Don't go and try and find stagnating areas that are just about milking the product line, because there's merit in that. But if you want to get fast advancement, you need to be in somewhere where there's opportunities ahead of you growing. We need a new manager for this. There's a new product come in, so we need a new product manager for this. There's a new division going to sprout up out of this. So that really helps to be in the growth areas of businesses rather than in the kind of cash cow areas of businesses. And some people like that, by the way. They like to be career people, 10, 15, 20 years, the same position, very steady away. They know how life is. They have a very good quality of life. But if you want to be in fast progression, you need to be in a fast growing business. So that's one of the first things that I'd say. And then the second, you mentioned it slightly, is you got to be a little bit cheeky and go out there and get to mentors. And in big companies, 30% of it is on business and acumen and ability and credibility and all these things. But in the big companies, 70% of progression and 70% of what you do, sadly, in my opinion, is really based around politics and politicking and networking. So if you're in a
Yes.
big company, one of the main things you have to do is build your network up and around you, and in sort of in sort of a diagonal way, so that when those opportunities come up, you have political support around you for you to take those positions. If you're an unknown, people are very cautious to put you forwards. If you're they understand you're good at what you do, but they also understand that you're politically savvy and network savvy. That helps a
Yeah.
lot as well.
Nice, nice. Now, thank you very much. I think a lot of people will be happy to hear that, and then now, of course, continuing in terms of your life after J&J, because you left and you continued working, obviously within the space. You could maybe elaborate further now on those other later points.
Yeah, so the pros of a big company like a J&J are the political environment, the networking, the opportunity, the frameworks, etc. But when you get a taste for a startup, I'm a firm believer, and I talk about this on lots of podcasts, that the large corporations are really amazing commercialization vehicles. They have amazing sales, marketing, networks around their regulatory, keeping things on. And they have brilliant engineers that do iteration. So they do gradual increases. They make a blue cartridge and a green cartridge and a slightly longer and a 50 and a 60 and a 70 and a slightly
Yes.
faster, slightly more curved. And they reduce cost out of the system as well, so that those things can be always profitable for the organization, even if the pricing drops with aging product lines. The key to that, though, is that you can't be best at both. So they're not very good at what I would call real startup innovation, the kind of real aha moments. They have a lot of them, but they don't have the infrastructure or the political will to be able to do it right, because they're risk averse. They have a multi-billion-dollar franchise they have to protect. Of course, they're risk averse. And failure in one of those companies, if a startup fails, it's potentially a career killer. So many people will not go and stick their neck out, which is what you've got to do in a startup. And I'll talk in a minute about my spectacular crashes as well, because you have to go and take risks in a startup, knowing that most of the time you're going to fail. That's a little bit counterintuitive when you're in a big company, because if you fail enough times, you could crush a multi-billion-dollar brand. So one of the things that happened with me was that I kind of had a dawning realization that if I wanted to do startups, and I really prefer the startup side of life, loved J&J for the 16 years I was there, but I realized that of those 16 years, the latter 6 in the startup piece of J&J was where I was the happiest and the most productive. So what I did is I left and I joined a group of bandits out in California, who are the real, what I would say, these are the sort of the real heroes of the startup world. So these are the people out of things like the Irvine Belt who really go and push the limits on startups. And I was very fortunate to be taken out of J&J and sort of dragged away by a really dear friend of mine called Brad Sharp, who is the
Nice.
epitome of the California startup dude. He knows, and he has done multiple startups, crashed multiple startups. So I was very fortunate to leave the J&J, which was probably the best of the best in medical devices, and then go and meet some of the best of the best in the startup world, and have an amazing set of mentors who took me and held my hand as I got into the real genuine startup world. And the little piece I want to talk, just add on to that before I go a bit further later, is the one thing you realize when you leave the big apron of the big company and you go to these small startups is you understand you know very little about medtechs. You know very little about how medtech really works. You know very little about how startups work. What you do is you have in those companies a very vertical and sectorial understanding of, say, how to sell a product or how to
Yes.
market a product. But that's not how you build a medtech startup.
Nice. I'm happy. I'm happy you say that, because I think it's often the difference between theory and practical. That sometimes you can read about startups, you can, go to every blog, listen to other people's stuff, talking about what they've experienced and how they plan to navigate their challenges. But until you actually in one, then that's when you only find out some key details that you need. And talking about startups, then, like, what would you say is a startup? Like, how would you define a startup from your point of view?
Yeah, so startups are actually a broader spectrum than most people think. It's not just a bunch of engineers sitting around some patent documents and making some tubes on a table. That's not just a startup, and it's not just the garage, in California on the hill and 2 or 3 people in a garage. I mean, startups can be 10 years in. A lot of startups are 10 years in and still going as startups. I think there was one definition of a startup that was said to me, and again, it was by Brad Sharp, who basically said, the minute that you need a full HR department, you're no longer a startup. I'm not sure if that's completely true, but I think it is a part of it is the size and scale of your company. And part of it is the life cycle of where you're at in the life cycle. So definitely in sort of the pre-seed and the seed area, which is where you really kind of find your feet and understand if you've even got a pre-concept going. Then you'll go through your Series A, which is kind of getting your prototypes going, heading towards getting regulatory clearances. Then your Series
Yeah.
B, Series C, where you're starting to scale up. And again, I think this is a big mistake that startups make. They think they've become a big company when they get to a Series B. And then they go and hire tons of people and they try and act and run and put systems and set systems up to feel and be like a big company. Now, a lot of that error comes that they hire in B players from the big companies, and those B players try and make a mini J&J or a mini Boston Scientific. And you have to understand that that's not what this is. Until you are really a full profitable, smashing your quarter numbers quarter on quarter on quarter for 2 years, I don't think you can say that you've really become a steady business. You're still starting up. It may not be the idea that's starting up, but the business is starting up. The commercialization is starting up. The install base is starting up. So you can define startup in several ways, but I think most companies now in medtech, they're going to remain a startup for 10 years. And that, I
Well.
think, surprises a lot of people.
Yes, yes. I think people tend to just think that once they've done this series around or like round of funding in terms of getting investors, etc., and they're selling products globally, they feel like okay, now we're now a startup. Particularly in this industry where sometimes you have to wait 10 years before your product is on the market. So sometimes people are just keen to shake off that label of being a startup, and that's why a lot of people like just run out of patience because by the time you've done 10 years of research and another 10 years of running the company, you probably have to be like 20 years in before you actually say to yourself, okay, now we're not really a startup. And like you said, quite a lot of interesting things there in terms of companies going out and hiring people. Does it link to the same ideas that maybe even though as you start to create more revenue, you should try to maintain like your cost of living, like they say, like it's like a salary inflation on individuals? Would you say it's the same thing for companies, to say okay, cool, now they have gotten more revenue, now they're making the mistake of continuously trying to adopt to this new revenue they're making to feel much bigger?
Yeah, let me unpack that
Mhm.
in several ways, and there's several ways to think about this. So one is about the financing. So when you land a big round of financing, um, as people say, you can end up spending like a drunken sailor. That's one of the sayings within the startup land, and you want to avoid that at all cost. And burn is critical, and you will burn whatever money you've got. You'll burn through it faster than you think. It will take longer than you think, and it will be more expensive than you think. That's just a fact of startup life. Now, the other problem that then happens is startup people are usually quite, the ones who start at the very early side are fairly much lunatics who, are not very good at process. They're not very good at a lot of the things that, a big company would like to buy, really. So what happens is you think to yourself, well, look, we need to hire a salesperson. So we'll go and hire an ex-VP of sales from Medtronic because they must know what they're doing, right? And the answer is no, they don't. They know what they're doing for Medtronic or for strategics really, really well. But potentially when they come, and it's not everyone, but some of them, when they come then to a startup, they're lost because you don't have the badge and the card to go in with Medtronic. And people say, well, who are you? What do you want? And you say, hey, but I'm Steve from Medtronic. And it doesn't work that way in a startup.
Yes.
You lose all that credibility. You'll have some relationships and things like that. But what happens is you end up with a lot more of these corporate people coming into the startup, and they're used to spending at a higher revenue. They're used to having an assistant. They're used to using, business class travel. You don't do a lot of business class travel when you're in startups, or well, you shouldn't do. Um, and then also what happens is as you get more professional investors joining you and they want you to create a professional board, one of the big mistakes that startups make is that they end up bringing in an ex J&J or an ex Striker person or an ex onto the board. And they have a very particular frame of reference of how they think businesses run. And they try and make the mini corporation. And I think that that's why a lot of startups fail in the later stages, because they try to be mini corporations when they're not. And the two rules don't apply. And therefore, they either run out of money very quickly or then don't become able to pivot fast enough anymore, because you've got this mentality, the corporate world mentality sneaks in, and you become this kind of weird chimera of a company, which is you've got a load of startup angst and needs and whatever, and you end up with these corporate sort of rules and systems in place and operating um, protocols that work very well in the large corporations but kill startups. So I think that's one of the problems that happens, and that's why you get into what's often known as the startup doldrums, which is where they get into the Series C and then it doesn't quite go as everyone thought. They're not quite successful enough to be bought. They're not quite throwing off enough cash, so need to raise more money. They're no longer sort of a startup in many aspects, but they still need to be a startup. And I think that's why they fail. I think that's why a lot of these companies fail at that stage.
Nice. And it's interesting you say that. And but like the next question I was gonna ask you was actually then how, like, what makes startups in MedTech quite unique. But before we even go there, I just want to actually ask you, because right now you got a course that you have where you teach people essentially how to start a startup in MedTech from A to Z, basically, like baby steps along the way, which I'm looking forward to taking part in. And for anyone listening and the want to know how to do a startup in MedTech, I advise you to go listen to that course. But like in a summarized way, without 26 steps, like in a few words,
Yeah.
how would you say?
Yeah.
How does one person start a startup? Like how does, because obviously it's not just a bunch of engineers in a garage. It's not. It's a bit more
No.
complex than that. So how would
Yeah.
we start a startup in a basic way for long term success, at least?
Yeah. So by answering this, I think I will answer your question about what makes medtech unique. I think they're both actually linked very much, and that's why again my site is called How to Start Up in Medtech.com and not How to Start Up a Company.com,
Yes.
because I believe that every sector is unique. I'll say it again. I would not be able to start a biotech company. I would be clueless. And I'm not sure that everything in my course would even reflect to that, because there is a uniqueness to medical devices for several reasons. Now, one of them is that, like many startup places, but unlike many, it's a highly regulated um, sector of the world. And if you don't understand the rules and regulations, you will get into trouble very, very fast. And a lot of startups that come out of universities don't understand that it's so highly regulated and it's going to cost them tens of millions, if not hundreds of millions, to bring that great idea all the way through the regulatory processes and be allowed to actually then commercialize. So that's one of the problems, is the regulatory, and it's a hard regulatory environment. Someone told me it's harder to put a medical device, a high class medical device, onto the market than it is to get an aeroplane certified to fly in the sky, because it's just so hard from a regulatory point of view. You don't do a lot of clinical trials with the aircraft, which are very randomized. Um, so that's one of the things. Now, when you want to start up, the second mistake that a lot of people make is they think that a startup is a have a go hero place where we've got a bunch of people who've got an idea, so we'll just have a go. It's actually way more structured than people think of what you need to do. And there are certain steps that you just have to do to be able to do it. And one of them is raising money, right? You've got to raise money. No money, no idea, no business. And I'm going to come to this word 1,000 times. Startups are startup medtech businesses. So an idea is not a business. And once you get that into your head, that an idea is not a business, it suddenly becomes clear and clicks. An idea can be a business if it's the right idea with the right market and then implemented in the right way. It can become a business. And why does it need to be a business? It needs to be a business because you're going to really have to raise a lot of money. And investors, when you get especially to professional investors, are only going to put money into something they think they can get money back out of. There has to be a return, a 10x return coming out of it. That's the way their businesses work, especially for VCs. So if you can't demonstrate that your great idea, which could be, by the way, the best idea in medicine ever, could be the best idea in surgery ever, but if it's not a viable business that can sell, be sold, and most essentially be profitable, then you don't have a business that's worth investing in. No one's going to buy it. You're never going to stand alone, and you're not going to IPO. That's just not going to happen if you've not sorted out the fundamentals of the business around the idea. So when on my course, what I try and teach people is stop thinking that this is a have a go hero, bunch of engineers, playing foosball and drinking coffee and climbing walls and all of this. This is about how do you set up your medtech business to be a long-term, up to 20-year sustainable business with a core idea. And the other thing about the idea is most of the time, that original idea dies, but the company survives. So the other thing I try and teach people is do not get attached to your baby as an idea. And most founders fail because they get attached to the idea instead of getting attached to the need that they're trying to solve with a business.
True. Nice, nice. That's really interesting. Really, it reminds me of a podcast I was listening, well, yesterday actually, or 2 days ago, by Naval Ravikant. It's quite popular, like in the Silicon Valley area. Like, he was one of the early investors on Skype, and one of the things he was talking about in terms of ideas, turning ideas into businesses, is that. Most people, like, when they think they got an idea and they think they got a business and they want to be secretive about it, they tend to be quite first timers, because the really experienced people, they're not too secretive about their ideas, because they know an idea is not a business. There's still a lot of work that needs to happen before it actually becomes a particular like business where you can actually make it scalable, profitable. And I think a lot of startup CEOs or engineers, like, I'm an engineer myself, so I know what you mean when you say a bunch of engineers together, because when we're in university, we just think that, okay, we take a 3D printer, we do this together, we've got a cool device, okay, let's just find a way to scale it and start selling it. And I think that's our default setting. But there's a lot more that happens into that. You have to understand the market. You have to know when is the right time to sell, how to sell to doctors. I remember when one of our calls earlier, you asked me, like, if I knew how to sell to a hospital, and I was like, yeah, of course I know how to make the device, how to make it good and everything, but actually walking into a hospital and trying to convince a doctor to buy it is something else. So so that was quite interesting, really. But then, in terms of what makes startups quite unique in medtech, besides the regulation and stuff, would you also say that because there's a lot of sort of like subject matter experts in this industry, does that also make it quite difficult? Or what do you think?
Yeah, there's a couple of things that make it difficult. One is that you need subject matter experts. And again, the piece of advice that I'll give to everybody starting a company is go and ask experts. Don't try and reinvent the wheel yourself. Unfortunately, many people doing startups are like super high flying academics that come out of places like Oxford, or they come out of Stanford, and they've always been successful. They can't imagine that other people in the world know things better than them. That just doesn't. It's just at that young age when you're doing this, it's just very hard for you to understand that. And I get it, right? I was the same when I was younger. But my advice in the older me talking to my younger me is saying, go and find mentors, go and find professionals, go and find people who know how to do it. I'll give you an example. You want to do a pitch deck, right? And everyone knows how to use PowerPoint or Keynote or Canva or things like this. And then they'll go off and they'll make a really bad pitch deck. Okay, it'll be terrible because a professional has not had their hands on it. And there are professionals out there, like Tribe Agency, for example, for just one, who they just make pitch decks, and they make amazing pitch decks. And if you were just to go and spend a little bit of money and time and put the ego away and let a professional get their hands on it, there's a very big difference between a bedroom record. Someone makes a music in their bedroom, and somebody goes to Abbey Road Studios. Okay, there's a gulf of difference. You can hear it, right? The same is this in medtech. There are professionals. There are professional commercialization people who will teach you and help you to understand how you commercialize. And I don't mean the day after you get regulatory. That's not when that happens. I'm talking about day five of your company. You need to know, how are we going to commercialize this? What does the model look like? What does the go-to-market look like? What does the cost model look like? Because otherwise your engineers will be shooting in the dark. They won't understand what they need to build to. Is this need to be a $200 product, a $2,000 product, a $20,000 product? what can the environment absorb? So the other part then about the difficulty of medtech is it's very different than the consumer world. On the consumer world, you decide, and you are the consumer and the buyer often in the same thing. So if I want to buy, I don't know, a new iPhone, I'm the consumer and the payer and the buyer and the user, right? Whereas in medtech, well, medtech is very different. So the actual ultimate consumer of your product is the patient, and they actually have very little to no say in the whole process of is that product used on them. So you have to start with the patient and understand what are we doing for the patient. But then you have the user is the person that will use your device, who's often a clinician or a nurse, or they're different people, surgeons, dentists, whoever, and they're the user of the device. And quite often, they're not the people who get the decision anymore of who buys the device. You have professional buyers within the hospitals. And then you have the people who give those buyers the money. They are the provider, the payers, either the National Health Services or the insurance companies. And it's so complex, the chain that goes into the decision to buy a medical device and the complexity of it and all the different proof points you have to make to get there. It's not like creating a new fridge magnet. This is really, really quite difficult. And again, unless you do a lot of homework and market research and understanding, you can end up with a really brilliant widget. You've got the world's next best mousetrap, but nobody is willing, able, capable to buy it or use it, and it brings no benefit to the patient. So it's there's lots of industries like this that have these kind of problems, but people revert back quite often in the startup mentality to what you said. A bunch of engineers sit around and think, build it and they will come, right? And it just doesn't work that way. And that's why I try and teach people on my course. It's really about building a sustainable business and getting all of those factors early on understood well to understand if this idea is going to fly as a business. And I think that there are just some very, very unique pieces to it as a medtech business that doesn't translate from others. And again, I would highly recommend that you find medtech startup mentors. If you go to these different conferences and the people talking on there are industry professionals who've never done a startup, stand up and walk out the room because you're going to get terrible advice. Now, they will advise you really well on things like the market or what a strategic company would be looking to buy or how it works in a strategic company. They'll be the best in the world at telling you that. But if they're on the stage telling young people how to start up in medtech and they've never done it and at least crashed two companies, I would be giving them little to no credibility because they're two very different things that happen. So again, medtech is unusual. Startups are hard and they're not part of the strategic world. And you have to get the right combination of knowledge to be able to do this, to build a sustainable business.
True. That makes a lot of sense, really. Thank you for that. And one thing came to my mind, and I thought maybe I could ask you about this, but because there is, as you mentioned, between the manufacturer and the patient, there's many sort of like middlemen there, whether it's the people who are buying, the nurses, the doctors,
Yep.
etc. And because of this, it also presents a particular challenge, right, for most medtech companies in terms of actually trying to calculate the costing. Because sometimes, for example,
Yes.
that explains the disparity in prices in different markets. For example, where in one market maybe slightly cheaper because there's less middlemen, whereas, for example, in the US, it'll be difficult. And some companies have kind of adopted different business models for the US and for other markets, etc. So, I mean, when it comes, would you say like that costing is also where a lot of people make it or break themselves, in the sense that if they get
Yeah.
it wrong, then they actually make losses, or is it too
Yep.
expensive? How do people balance that? Because, like, out of curiosity.
Yeah. Yeah. No, that's a really good point. So you have to make a certain amount of profitability, which people get mixed up with the amount of profit, and you've got to make both, right? It's useless, but it's useless having 80% profitability and only selling $1 because you'll make 80 cents, and that's not a business. Uh, So you can't get hung up on profitability, but it is important because there are just rules and regs of, a distributor is going to take 25%. The manufacturing is going to have this. The cost is going to be this. The regulatory is going to cost you this. The cost of having your sales force and your go-to-market is going to be X, Y, and Z. And there are ratios that are pretty well known in the industries. For disposables, it's around about 80% gross margin you have to make. Whereas on reusable equipment, something like a big robot or a big CT machine, it's going to be close to 40, 50% margin you're going to have to make on it. So there are sort of limits of what you can and can't do. And many startups never work this out because they start with something called cost plus manufacturing. So what they do is they have a great idea. The engineers are just told, go off and build it. They build this great idea. They have this great startup idea, and it costs you $200 to make each one. And then what they do is say, okay, well, now looking at all the ratios and to make it work for our investors and to make sure we've got enough money for the lights and the coffee and the paying of the wages and all that, we're going to have to sell it at $400. And then they go to the market on the day of launch and go to the hospital and say, here it is, here's widget X, and it's $400. And the hospital says, but we only have $30. That's the margin we've got. So we can't buy it. You're $370 overpriced. And that's quite often, more often than you imagine, how that happens in the real world on a daily basis. And then you're dead, right? Because you can't sell. And then the investors are saying, well, why are you not selling? Well, because you didn't do that homework right at the beginning. So when you've got all these middle layers in it, and that includes internal middle layers, how much is it going to cost you for marketing, go to market? How much is it going to cost you for advertising? Most people don't realize that the R&D side of it is actually one of the smallest expenses within the life of the company. The amount that you put into engineering and prototypes and all that kind of stuff and validation and verification is quite low. Clinical trials are massive. You get stung with a big FDA clinical trial where they want you to do a big randomized controlled trial with 1,000 patients in each arm. That's going to cost you maybe 30 to 40 to $50 million, right? And it might have cost you $3 million to get the product to where it was. But now you've got to find $50 million just to do the clinical. And then you're going to go and compete head on with a Johnson & Johnson or a Medtronic or someone, and you're going to need another $200 million for your go-to-market and your commercialization. And people sit there saying, we'll go out and I think we're going to need to raise something like 10, 15 million and sell the company. That's what I hear every day. So again, those early calculations and sitting with experts, get yourself a fractional CFO who's done startups before and buy a couple of days of their time a month and say to them, do our models look real? And when they start laughing and rolling around on the table because they see that, you've said it's going to be $8 million of R&D and a little bit of clinical, and that's it. That can save you a lot of pain and heartache later on, but it can also just reset the business to a sensible way so that in the first few months of life of the business, that for the next 10 years, you're going to have to go out and raise 5 rounds of a total of about $300 million to make this really work. Depends on the product, right? Always depends on the product. But, there will be hundreds of millions of dollars genuinely needed. And if you find that out late on and your product is not set up correctly for commercialization, i.e., you've not got the pricing structure right that fits in, you can't get in the US what they call coding and coverage. So you can't get it to fit into a code. You're going to have to try and change the healthcare system to give you a new code. You're probably going to fail. So all of these things need to happen early on. And again, I really try and encourage people on my course, go through the whole course, because what the whole course will do is it was in 2 months, just at night, you'll do 2 or 3 videos a night. It will take you through the 15-year span of the company. And it will explain to you what happens, almost month by month in that 15 years, and explain to you all the things you need to think about so that when you finish the end of the course, you've reached the exit. And then you understand why I said back in module number 5 of 100, you need to get a marketing person to tell you this now and not, 10 years down the road, because it counts and it matters. So again, there are resources out there. Mine's one of many. I think my resource works because I've done it and I've failed many companies, but I've also created a triple unicorn. I've been part of an amazing team that created a triple unicorn, which not a lot of people have done. I've raised $1.5 billion in my time from investors, and some of that's been good, some of it's been bad of what we've spent. But I've got scar tissue in there. And again, my advice to everybody is don't try and invent this yourself. There's lots of people who have already fallen down those holes and they'll tell you exactly where they are. And if you can miss 2 or 3 of those holes, you will save years and millions by avoiding them. So ask, and don't be scared to ask. And there's lots of great knowledge out there, but ask the right people. If you want to know about what happens in strategics, do not talk to startup people. Talk to people who are in strategics who know how it works. If you want to talk about the M&A side of strategics, talk to M&A people in the strategic companies. But if you want to know how to start up a successful medical device business, go and find people that have actually done successful medical devices with exits, because they'll be able to tell you. And the question you've got to ask them is, how many did you fail at as well? And if they say never, none, they're more likely lucky than they are, experienced, seasoned medical device people.
True, nice. And in terms of reaching out for experts, another thing that I had on this podcast was I listen. As much as I have a podcast, also I'm a consumer of many podcasts. And one thing that was mentioned was when seeking out sort of like subject matter experts, it's probably better to go to smaller companies because the accountability is much higher there, and no one can throw the blame to other people. Or would you say it's better to work with big, more reputable firms? When it comes to picking which SME you pick from, because at least from a smaller company, like for this one specific thing, it's just them, or is there any other general rule you might
No,
consider?
I generally go and try and look at the resume of the expert. There are actually there's some brilliant people in some of the big companies that have actually done several startups and then got acquired into the companies. So you just got to look at their resume, and you got to say, what experience does this people have, and does that experience meet exactly what I'm asking the questions on? Be it regulatory in a startup or regulatory in a big company, or M&A from the sell side of a company, or M&A from the buy side of a big company. You have to look at the question you're asking and then try and match up the professional with their experience. And you can find them all over. I mean, I was in J&J, so I know how J&J worked at the time that I was there, so I can give you that experience. But I've also worked in a small medium like RTI, worked in there, and I've worked in startups, big startups and tiny startups. So if you ask me about the questions, I can answer generally about some of them. I can't tell you the up to date in J&J because I've not been there for a long time. But I'll tell you what I do know about how it still works from my friends that are there. But if you want to know about J&J, go and ask somebody in J&J and just look at their resume and find them on LinkedIn, or find them at a conference. That's another great way to go and find people. So I always say to people, if you're in a startup, people say, why would I go to a congress? Well, you're going there not just to show your wares. You're going there to network and interact and to actually meet people. So if I get a cold email, interesting, great, I'll try and respond. But if I'm actually at a show, let's say I'm a region director for Boston Scientific at a show, and you go to them and say, hey, we're doing a startup in this area. Could I just ask you a couple of questions? Can I buy you a coffee? That's actually a really good way to get to people straight away. Very few of them are going to turn around and say, hey, we just don't talk to you idiots, go away. They don't do that. They're generally polite. They may not have time right there and then. If there are sales on the sales side, I guarantee you they love to talk. So they will talk and they'll try and help. And if it's a more seasoned professional, they'll know how hard it is to get going in this business. So they will genuinely help. And there's a lot of great people in our industry that are very willing to help. But you'll be amazed how many startup people think that they know best, think that they've got all the answers. And if they've not got the answers, they think they can work it out from first principles, like continuously. Not the best way.
True. No, that makes a lot of sense, and I think sometimes that comes with the with like when you start something, it's like you have this mind in your well, you kind of plan it out to say, okay, I'm gonna work on it for 20 years, do an exit, then maybe spend the rest of my life chilling in some sunny country somewhere, just trying to recuperate the efforts you made. And talking towards to the end of that successful startup, so for someone who has successfully started a startup, they have scaled it up and everything, how can they sell that? And this touches on the current state of the industry, and like the future in terms of where you think it's going, because what's common knowledge now is that mergers and acquisitions like in medtech have drastically dropped in the last 13 years. So most people are thinking, okay, if I start the startup, like and I do it correctly, what are the exit routes now, since there's less of them being bought and acquired by the big players?
Yeah, so I think there's two or three things that. So if you actually look at 2024, there's been a resurgence of acquisitions. You look at J&J, took Shockwave and took Abiomed. You've got Storts that have taken a census, and there are multiple tuck-ins. Strikers on a roll at the minute. They've done Nico and they've done several others. So there is a sudden renaissance of buying again, and there's been a quiet period in that. I think strategics have become more cautious of what they buy and when they buy. They want to see that you've got to the point where not only have you proven that your idea works, which was the old. So in the old days, pre 2007, you had a great idea and you got some patents and you showed it kind of worked on a benchtop. You could sometimes sell the IP. That kind of morphed into, well, have you shown that you've got regulatory clearance? Okay, that was the next barrier. Are you on the US market? Are you on the European market? Have you got China clearance? And that became the bar for a lot of the strategics. Then it became, have you shown some small inklings of commercial success? Does it actually work commercially as well? And I think where we sit in 2024, 2025 is, are you on a growth phase? And is this acquisition accretive to us as a company? And do we gain sales and we just put our organization behind it and we really go up and go big? Okay, so that's one of the models today is, get yourself to be having steady, successful commercialization that's, meaningful as well. Now, and that's challenging, takes a lot of money. But I think that if I was advising people making startups today, you better have a damn good plan that means you can stand on your own 2 feet and get to commercial success and profitability in a time frame that you find suitable. Do not rely on, don't worry, we'll just hang on long enough and someone will buy us. That'll be a horrible fire sale at best, and it'll just be a bankruptcy at most likely. 85% of medical device startups fail. And out of those 15 that then get bought, it's a very small percentage that actually, if you really work it out, did well out of it and go and do the Caribbean beach and sip margaritas. There's not that many. There's not as many as you think that go and do it. And the way that you can easily go and understand that, because a lot of these numbers don't get made public. But if you want to really go and easily understand that, you can look at where it has been made public and you look at the amount that it was bought for, and you can work out the amount of money that went into it. And therefore, you can then start working out, what do those founders end up with? And it's a lot less than you can imagine. They get diluted out a lot in this. And if it's not an amazing sale, if it's a fire sale off the last round, they won't make as much money as you think. And the second way to look at how successful people have been is how many people then go and get a marketing job in another company. So if you've just made, $10 million, why are you going and getting like a junior or middle or a VP of marketing in a big company? Some people will be bored and they'll go and do it, yes. But if you've made ample amounts of money, you'll either do another startup or you will, retire and disappear off the scene, which a lot of people do, or you just become on the speaking circuit and do podcasts and stuff like that. But again, there's not as many as you think. And I think in the past, this kind of dream where the startup people go off and become multimillionaires at 25, and that's gone. That's all kind of done. It's a hard slog. And I try and I don't want to discourage anyone from doing it, but I want people to be realists. This is if I look across my career, the startups are the hardest thing you'll do. You're most likely to end up destroying your relationships in your life. You're most likely going to neglect your children. You're most likely going to neglect your partner and take a lot out on your partner. You're probably not going to have money for a lot by that 10 years. Your wages will be well under what you could get if you went and worked for a strategic. You'll have probably every 6 to 18 months a period when you start running out of cash and have sleepless nights for months and months and months and be wondering if you're going to have to lay everyone off. You'll be spending your entire time doing nothing but going out with the begging bowl and begging for money to investors. That's the reality of a startup. It's not all the, as I say, the foosball and the climbing walls and the nice cappuccinos. It's you get some of that as well, but it's freaking hard, right? And it's 85% are going to crash and burn. So again, don't put your mortgage on it. Make sure you never put your house in a startup, because the likelihood is you will lose your house. And I have seen people lose everything because they were so convinced that their baby, their beautiful idea, was just the best thing ever. And the markets told them it wasn't. Or, there was a banking crisis, 2007, 2008. Or there's a war in Ukraine, or there's things beyond your control. And it's hard enough as it is. And then when you get exogenous market impacts, a lot of startups will go under. Again, I don't want to discourage people from doing it. But what I want that people go in with their eyes open. And therefore, when I say to them, go and put your hard graft in at the beginning and do so much research before you put one screw into one device on an R&D bench. This is why you need to do it. And I think in the strongest terms, I'll give advice. Do not let your R&D people do anything till you understand what the final product needs to fit into, the economics, the clinical situation, the regulatory situation, because then you'll be able to give directions to your R&D team and to your engineers in a much more constructive way, where you're able to tell them it can't cost more than $55. It can't. And they'll say, well, you only get this feature set. Great. And that feature set, don't make it so weird out of a new material that we're going to have to do a PMA with the FDA, because that's going to cost us an extra 40 million and an extra 3 or 4 years. So you have to set the sandbox really clearly. And you do that by doing all of your hard work up front. So coming full circle to what I was saying, in my course, I actually get a lot of people who say, I'm never going to do a startup now. I've been through that. And I think that's great. They will go and get a great job in a strategic, and they will go and have a brilliant career, and they won't lose the house. They won't lose their family. I've done my job. And that 85% failure rate might now go to 80% failure rate, because those 5% of people don't even start in the first place because they would never have got there. The other piece of what I try to do is, and somebody said to me, what's the aim of what you're trying to do in the latter part of your career? One is to try and help as many people as possible, educate as many people as possible, give people the reality of what they need to do. And then another big piece of it is, I think I can get that 85% to 50% by just killing bad ideas early on. And again, I'm not talking about that it's a bad idea from a technical or a medical point of view. I'm saying it's a bad business idea. And I'll give you one example. Somebody came to me very recently with an amazing idea. It was so clever, and it was for what you would call an orphan disease or an orphan disease state. And it was brilliant. And worked out it was going to be a PMA. It was probably going to cost about 300 million to get it to market. And the total market worldwide for it was less than 100 million. Yes, you don't need to be a business expert or a financial expert to work out that 100 million is the maximum it's worth, and it's going to cost you 300 million to get there. And it would take you at least 30 years to even get close to break even on a profitability basis. So again, it's not that the idea was bad. It's not that the disease state didn't need attention. But if you want to go and make a for-profit startup, not a non-for-profit, because there's lots of great non-for-profit ideas that go out there. But if you want to make a for-profit business where somebody is going to actually pay you and put money into your company and expect an exit, then make sure it's a damn good, profitable business idea at the beginning. And if I can get rid of those ideas that shouldn't have been born in the first place, I think the ones that are left have got a 50-50 chance of surviving if people just follow some basic rules.
Nice, nice. No, thank you very much. That makes a lot of sense, and like I learned a lot of things there. But just to ask you one last question, really, is then like there's this saying, well, that's quite popular nowadays on Instagram, TikTok, and a lot of people in my circles say it around, floating everywhere. Is that they say sometimes there's this idea that to create a company, there's never going to be perfect conditions, there's never going to be anything, and starting is the best thing you can do and sort of like learn along the way. And I think that's where most people are making the mistake, based on what
Yeah,
I'm gathering here, particularly in this industry where it's
yeah.
heavily regulated and stuff. So sometimes you really need to consider a lot more stuff instead of just going off your gut feeling. Is that what you're saying,
Yeah,
or what did you say about that?
no, so I think that fail fast, break stuff and stuff works great when you've not got patients that die on the end of it. Okay,
True.
when you've got patients that die on the end of it, you can't just do stuff and fail fast and break stuff. That's kind of the Silicon Valley software model, where yeah, you're right, and you got fast iterations and stuff like that. But in a highly regulated healthcare industry where you got patients on the end of it, it doesn't quite work that way. So I agree that every 1,000-mile journey starts with the first step. I agree with that, and you've got to get going. But the first 100 steps are not to go and start just doing stuff. The first 100 steps is to get educated, because it's not that difficult for anyone who's got a little bit of common sense. When you think about it and sit down and hear the steps, you go, of course, I'll give you a really concrete example of this, okay? And why, again, just get yourself educated. So one of the most important things about a startup, if you're going to get funding, is your location. And people don't think about this. So I live in a small town in the middle of a small forest in the middle of Germany, and there's a tiny mayor who's got a small pot of money for 10,000 for anyone to start a company. So I found my company in this small Black Forest town in a little hamlet in the middle of Germany because I could get a little bit of local funding from a local mayor. Okay, and the business starts growing there, and I use that as my address, and that starts going onto my production labels, and my quality system gets that address in it. When I go to an investor and I say, hey, I'd like you to come and invest in my company. And this California investor says, let me get this straight, right? So I take a flight from Los Angeles to New York, then I get New York and I go to Frankfurt. And then from Frankfurt, I get one up to a small place in Mainz. And then I get on a car and I drive 4 hours down to Schwanshold, wherever it's going to be in the middle of Germany. And that's where you want me to come once a quarter for a board meeting. Do you think they're getting money? No.
They're not.
Right. Okay, I need 15 software engineers. How many are sitting within, a 15-minute bike ride of my office? None. Zero. So now what do I have to do? I have to have people drive 4 hours to come to work every morning? No, it can't work. So I know it sounds obvious when I say it now, and you go, of course no one's. You cannot imagine how many people found their startups at home or in a little unit down the road in these absolutely godforsaken places. Beautiful to live in, terrible to do a startup. You've got to go to the cluster. You've got to go and look. Why is it that most of the startups come out from 4 or 5 major regions in the US? Irvine, Santa Clara, Minnesota, the Boston area, a little bit now coming out of Texas, from Houston, places like that, because there's clusters around there. There's employees who are looking for work. There's know-how. There's prototyping shops. There's legal people who know how to do patents in MedTech. There's an ecosystem around there. So again, I know it sounds obvious, but there's a little piece of advice for anyone. If you're going to build a startup and it's going to be in a certain sector, work out where all those startups live and you found your company there, and if that means getting off your ass and going and living there in a small place to go and do it, how badly do you want your company to survive? If you want to be the comfort of living at home with your parents, because you pay little to no rent, and you can just walk down to the garage place where you've got the startup, you shouldn't be doing startups. So that's the sort of advice that you need to get early on and understand
True.
early on. That's a basic mistake that if you avoid that kind of mistake, 8 years down the line, when you're trying to raise a Series C, you'll have a lot more success because you're in the Frankfurt area, 15 minutes from the airport, and any investor can fly in with one flight and come to you and have a board meeting.
Wow.
Basics.
Wow. Makes sense. Thank you very much, Steve. That I learned a lot, and I'm sure a lot of people learned a lot. Like I'm gonna be putting like those links below of your course, like your LinkedIn and your website as well, for people to come and find you. Because you shared a lot of information. I can't wait to get started on that course myself. Because I'd like to start a startup, and it's part of the reason why I took a small leap of faith by starting this podcast, to try to program my mind towards that journey. But I know it's not going to be something that happens overnight. So yeah, thank you very much for coming on the podcast.
You're more than welcome, and thanks for having me on. And again, anybody who needs help, reach out to people on LinkedIn. There's a lot of great people out there who've got phenomenal knowledge, and they're always willing to give a bit of advice. And that tiny bit of advice can be the difference between success and failure of a startup.
Yeah, thank you.
Thank you.